welcome to Hello Cedar Falls, everybody. Special edition this time. My name is Amanda Huseman. I am the communication specialist for the city of Cedar Falls, and during our Hello Cedar Falls podcast, we always invite members of our community, city staff, representatives to talk about important things in the city. However, this is a special edition. May is Mental Health Awareness Month. September is Suicide Prevention Month. And I know locally in the Cedar Valley, there may be a lot of people in need right now of resources, advocacy, and information on how they can help them and their loved ones with mental health issues. So I've invited you all here to help talk to people about what they can do, help that's available, and help for people of loved ones that are suffering from mental health issues. So if you'd like to introduce yourselves, we can start with you, Zach.
All right, Zach Andersen, Cedar Falls Public Safety.
Hi, Chris Latta, Director for Behavioral Health for MercyOne.
Ryan Nesbit, co-founder, Alive and Running Iowa.
And I'm Tom Eachus with UnityPoint Health, Blackhawk Grundy Mental Health Center.
Yeah, so there are resources, obviously, in the Cedar Valley. We'll get into how people can contact your organization. To start this, though, this is a very, and so if I say ums a lot, I do apologize. This is a very important subject for me. I had lost my brother this past December. He had lost his fight with mental health issues, and it's something that has affected our family greatly. And so it was important for me to gather up everybody that I could in hopes that this can reach people that are in need, families that are grieving. And if we can help one person, then maybe we can make a difference. So coming from somebody that went through this, I think one of the biggest things is that you think that they're getting better. And that's what we thought very much so with my brother. We thought he's getting better. He's doing better. He seems to be doing better. And it was a big surprise when this happened because we thought he was doing better. Now, Chris and Tom, do you hear that a lot from people when this happens?
Unfortunately, Amanda, we do. One of the highest risk times for people who experience mental health problems where suicidality is an issue, one of the biggest risk times is when they get out of an inpatient hospitalization. They're in the hospital, and Chris can attest to this. It's a comforting environment. There's a lot of support. There's a lot of treatment going on, and many times they get out to the same environment that they came from. So where's the ongoing support and structure and activity? So yeah, unfortunately, I've heard it a lot.
And I'll take it a step further. Studies will even show you that a lot of times when someone has made that decision that they're going to end their life, there's this overwhelming sense of peace. And you could really misconstrue that as a loved one, a support person, and think, to your point, they're doing so much better, when in fact they've kind of found this inner peace within themselves that they see an end in sight. And so, yeah, Tom's right. The hospitals and even in the outpatient environment, there's certainly love and support and everything else, but you've got to have a family. You've got to have a support system outside of that. We're a piece of the pie, but we're not the full solution.
And so, what are the signs then that families should look for?
Well, there's several of them, Amanda. Number one is a drastic change in mood or behavior. They're just not like they used to be. What's going on? People tend to withdraw and isolate. They used to be at bowling league every night, and they haven't seen them in 3 weeks. They don't go to church anymore. Where are they? What's going on? Certainly a big sign is people giving away prized possessions. I really want you to have this. This was important to us. Where did that come from? You got to ask the questions as to why. Certainly talking about death, talking about pain. I just want the pain to end. All those are warning signs that people need to listen to. And when you get to Ryan does a lot of training in terms of identifying risk factors. So there are some things that people can look for.
I think that's well said. I think, let's face it, the world has so vastly changed in the last 6 years from the pandemic forward that social isolation really kind of became a norm. And for some people, that was really great. Your introverted people may have really loved that. But some of the folks that were really already struggling, they were isolated that much more from the support system they may have had. Access to care looks much different in person versus in a virtual manner. any different isolation things. It's really it's difficult for anyone, and I think we're just now starting to begin to understand perhaps the tip of the iceberg of what that last 6 years has really done to people in our community, either with diagnosed or undiagnosed mental illness.
Yep. And Zach, we've seen an increase in calls. I feel like even before, like I said, this obviously affected my family very greatly this past December, but I know in the past few months before that, I was speaking to public safety quite a bit about how we've seen an increase in calls locally here, people we know right in the Cedar Valley.
Yeah, I definitely think there's more and more, there's always an element of mental health in a lot of our calls. We see it different levels of severity, whether it's actually a med psych call or it's frustration of getting in trouble with the law. You know, if it's criminal, that always spills over into more mental issues because of dealing with that when they're already dealing with their own mental problems and now they've done something wrong or they're in trouble. And also too, like when people get help, I was going to point this out earlier, like when we were talking, or when people get out, they have the help. They might not want to necessarily be there, but when they're there, they're getting help. Then when they leave, they're on their own, and they're like, well, now I don't want to do this on my own. They don't always want to be in a facility or getting help also, but the realization that you're on your own, then I think that's when you see that they're like, well, I'm tired of doing this, and I can't do it on my own. So it's kind of a fight of not always wanting to help or someone else, but also I don't want to do this by myself either.
And that's a big part of the stigma we still deal with in mental health, Amanda. I don't want people to know that I'm depressed. I don't want to pick up the phone and ask for help.
It's
pretty
easier to say I'm fine.
That's right. It is.
It is with a lot of things. I mean, not just mental health. It's easier to say no, I'm good.
The research that's out there says that 60% of people with mental health problems never get the help they need, and the big problem that we have is stigma. It's just still seen as something you're too weak. There's some moral flaw. We've tried to make it okay not to be okay, you know. And one of the things that's helped all of us over the years is when some of the celebrities that unfortunately take their life. Wow, Robin Williams, he had it all. I mean, money, fame. How does that happen? Well, it happens a lot more than what we know. So I agree, Zach. We've seen an increase in referrals as well. People very stressed out.
Well, in Tom, you talked about 60% of people with a diagnosed mental illness don't get the help that they need. When you think about it, you know, a study take it a step further. It says 1 in 5 people have a diagnosed mental illness. Now let's call that out. That's just a diagnosed mental illness. So when Tom talks about stigma, those are the people that were brave enough to say, I'm not okay, and went and got that help. Realistically, we've got 5 of us here right now, right? 1 in 5. And that's if we all said we had needed help and we received a diagnosis. There are so many people out there in our community that because of that stigma have been so afraid to get help. And I have to tell you, mental illness doesn't know a socioeconomic class, your profession, your anything. It's ourselves, it's our neighbors, it's the professionals in this community, it's everyone. And we really have to do so much work. That's where Ryan's organization is just so phenomenal in helping to provide the education and awareness to break down some of that stigma. Because Tom spent, how many years have you been in mental health, Tom?
38.
38, and I've been 19. And we haven't solved it yet, have we?
No.
Right.
Well, and the other thing, Amanda, when you speak about your brother, and the reason why it's important to look at early intervention and prevention, again, going back to Ryan, people who develop mental health problems, usually mental illnesses, have symptoms and behaviors 7 to 10 years before they even get treated and diagnosed. So those problems become entrenched, and then it's even harder to ask for help or be willing to accept help. So there's a lot of things that we can do as a community to make it okay to ask for help, which is where Ryan, of course, comes in.
It's really a benefit to all of us, because if we don't do that, we have this vicious cycle where they end out in Tom's clinic or my clinic or the hospital with me, or having services with Zach. And I mean, the reality is that, you know, if any sheriff in any county will tell you that the biggest mental health provider in that county is typically the jail.
Yeah. And we, just to add on to that, like, you know, wanting to end your life isn't a crime. That's the tough part for us. Right. So, you know, it's a lot of times unlawful for us to kick down a door, to go in. We have to go off with all the information that is presented to us. Every incident is different, but a lot of times, maybe we get to a person with mental health issues because of a crime was committed, but a lot of times there isn't a crime committed. The ambulance is called because of the nature of the information. Maybe law enforcement goes there to provide safety. So you have, fire, EMS, police there, but it's not just a criminal act sometimes brings those issues to light. And then they're more forced to get help because that's a good avenue of, I made a mistake, I need help. Like, I think this happened because I'm struggling and I need help. And that's, it can go either way. Like every situation is different, but that's kind of what we see on our end is it goes one way or the other. So.
And when you're talking about things like weakness and how people perceive that, I can certainly see that in my experience. My brother, he had severe epilepsy as well, which really caused him to not be able to do the things he used to be able to. He couldn't work in his job anymore in manufacturing, he couldn't drive anymore. And I think a lot of that really started honing down on his self-esteem, on his ability to be like, I'm a man, I can do this, I can provide. So Ryan, you work a lot with the community. Can you talk about your experience working with people?
I got to play catch up here. I'm at the table with the heavyweights. Chris did say something about the 1 in 5. Where's my camera? It's me. It might be all of us, but this is why I run and have deep faith and have good friends. Because if I didn't, I might be coming to see you, which isn't a bad thing, because life can be hard for sure. I want to share one other thing too. If you're watching this or listening, this isn't just at the high level of, oh, they're talking about people that have to be institutionalized or go to the hospital. I mean, this is every day, and this is where I get to go do stuff. I've been on tour a lot lately, talking, doing presentations, and I learned a lot from a 6th grade girl who in front of all of her peers said, when I walk into school, it's time for my fake face. I was like, oh, you just described all of humanity. And you have realized that at age 12. So there's signs leading up to suicide for sure, but I think one way we can help prevent suicide is if we start being real with each other instead of our fake lives, and I call it the fake book, Facebook. Why don't we just be real and say we're struggling and have that camaraderie versus we have to put on this fake face all the time? Because that can really wear you down and tire you out for sure. I can't remember what your original question was. I was playing catch up.
No, I was just talking about how you work with the community. Obviously, you're out there, you see these things every day. When you're that's absolutely amazing what the 6th grader said about a fake face, because in my experience, I'm seeing all of this happen and kind of like in real time playing in my head. The solution my brother had, when he was struggling, was to take on more work. He just wanted to take on more work and just keep proving himself and keep proving himself. And I think that was like a deep insecurity that he had there, that he was trying to overcompensate for.
Oh, I fully agree. I'm an ultra runner, and as we sit here, I'm injured, and I'm not at peak happiness right now at all. I think I'm going to get back to running, but I'm also 50 and probably not running ultras the next 20 years, so I have to replace that with something else that makes me happy. And I'm doing that right now, and it's hard. Man, if I got to get on a bike, oh boy. But I'll do what I have to do. But it's just, we're kind of grassroots. I mean, Alive and Running Iowa, he's got the tie on. You wouldn't see me in a tie unless I was at a funeral. This is the way I roll, which I highly respect Tom. We're in schools, we go to communities, we do talks, we do trainings. We've started support groups, we bring in national speakers. So we're playing a role that's kind of everybody. I think we're making a difference, I hope we are. So people can go to our website or just Google Alive and Running Iowa. And if you're listening, it's not just a running group. It's about suicide prevention and mental health.
Well, we appreciate everything you do for the community, and it's sorely needed. Like you said, 1 in 5. And I always think about, so after my brother had passed, talking about how the impact of epilepsy, for example, might have factored into depression. Do you, Chris and Tom, do you see that where other diseases help raise?
Yeah, absolutely. I think comorbidities really kind of go hand in hand with mental illness, and there are times where you almost have to say this is the chicken or the egg conversation, right? Is the chronic medical condition I have or the chronic substance abuse that I have, is it causing my mental illness, or is it the fact, or am I using those substances or whatever it may be then later to self-medicate and try to compartmentalize myself from those symptoms? I think it's very common to see.
Yeah, the research would tell you, not to keep quoting research, people with serious mental illnesses, schizophrenia, depression, PTSD, some of those bipolar disorder, usually those folks have 6 to 7 chronic health conditions in addition to their mental illness. So it makes sense, epilepsy. And when you think about what you said about your brother, Amanda, the loss that people experience, I can't work anymore, I don't have a purpose in life, what is there for me to do? Those things, the highest rate of suicide right now, surprisingly, is people over the age of 85. And when you think about what they've lost, their career, their eyesight, their ability to drive, their independence, it's a risk out there for everybody, depending on what type of stressors they have. And many of us mentioned the support that they have in the community. There's a lot of people that are much too isolated. And so where's their support when things bad happen?
All right, so we obviously talked about Live Up Running and how people can get in touch with them. Chris and Tom, what are services, how can people get in touch with your organization?
Well, you might mention that, Amanda. I put that together. Basically, there's a couple of national resources. First one is 988. You know, we pushed for many years to get a system so we don't have to call Zach at 911, because many people don't need law enforcement, as you said, Zach. I haven't committed a crime.
Right.
I'm just depressed and I'm thinking about killing myself. So the 988, you get connected with a crisis resource center, trained counselors. You can text them. Same thing with Your Life Iowa. It's a statewide resource. And then there are many local organizations. Chris works for MercyOne. I work for UnityPoint. There's People's Clinic that has a mental health program. Elevate has a mental health program. UnityPoint Clinic Psychiatry in Cedar Falls. There are Pathways. There are a number of organizations that pretty have a wide range of services, not just come in and get medicine and go home. Although 75% of all the psych meds prescribed in the United States are prescribed by primary care physicians. So that's usually who do we go to first when we have a problem? Go to your primary care. They're very good at identifying depression and anxiety. The more serious mental health problems, they usually refer to specialists, which is Chris and I's shop.
Right.
So,
Well, and it's interesting too, because I think, as you pointed out, we've got primary care providers that are starting maybe medications or maybe referring out, but it's only one piece of the puzzle. We've kind of already talked about that. Really, the piece where Tom and I come into play, and some of these other community partners, is the counseling piece. And meds are wonderful, but they are not the end-all, be-all. And truly, that's a need within this community, within the state, within the national level. We need so many more counselors and therapists, because prescribers are wonderful, but again, it's only one piece of the puzzle. And I think that people are really starting to lean into that and understand that a little bit more. And again, it goes back to breaking down that stigma and being willing to be vulnerable and being able to say, I'm not okay, and that's okay.
Yep. And what we're talking about, Zach, really is that these are the advocacy groups, these are the medical groups and everything, because that is not your primary job, and we have restrictions over what public safety can do.
Like almost every officer, if not all officers, take crisis intervention training. So they do take training. Then our ambulance services, hospital services, they probably have the same or more. So we have all this training to deal with these problems and issues, but we're kind of like last resort. And what it boils down to is people need someone to talk to and talk it out, work it out. We're more of an intervening with an issue. Like
actually,
I said,
Zach, many times you guys are first responders.
we are.
For people
Yes.
that have never received treatment, so you guys have the opportunity, and I love the training you guys do, just in terms of knowing what to look for, what to ask, what to do, as opposed to, well, I'll just take them to the emergency room and dump them off. That's not what people
That's a
need.
big thing that we try to convey to people when we go on calls is, yes, we are here first. We are not here because you are in trouble, to cause more of a problem, cause more mental strain on you. We're here to tell you like how we can help and what we can do for you. So I know that's what we really try. I know we're always rushing to the problem and we're such problem solvers. But with mental health, we know like we're not going to show up and solve the problem like right away and like, oh, you're fixed. We fixed that problem. We know that. So our partners, like Elevate is one of ours. But usually it's trying to voluntarily get them to go to the hospital, talk to a medical professional, as we are not.
Well, Zach, I feel like too, one thing you guys really strive to do on any of these medical type calls that could devolve into any number of different scenarios.
Yeah.
You guys do a great job of not only de-escalating, but probably more importantly, not escalating anyone else.
Yes.
Right. I think that's a big piece. I'm assuming in your crisis intervention training
Yes.
that you guys really focus on, because truly these can be very chaotic situations at times. I
Yes.
can only imagine, and I think really having the willingness to treat somebody with dignity and respect in those situations probably goes a long way.
Slow down, listen are two of the most important things for us, because we're so run to the problem, fix the problem. When you get there and it's like a mental health thing, it's like slow down, listen more than you talk. What are they saying? What are their issues? And then give them feedback or give them options.
What is, I mean, and I'm sure that I share this with a lot of people that are going through something heartbreaking. You just feel so helpless. What, in your experience, are things that loved ones can do when they are worried about somebody, when they just feel like they're getting shut off and they're hearing that, oh, I'm fine, and they know they're not fine, but they just keep hearing, no, I'm fine, and there's that wall there. What are things that loved ones can do?
Ryan, from your experience with your support group, what do you
Yeah,
find?
I think she's kind of talking about to help prevent suicide. I would say 988 all day, which that's way easier to remember than 1-800-273-TALK.
Yeah.
988. Safety in all the trainings, talks I do. If I could only say one word, how do you prevent suicide? Safety. We have to keep people safe from themselves. This is the reason I'm alive today, is safety. Whether that means weapons in the home, whether that means we physically have to have eyes on this person 24 hours a day, or they need to go stay somewhere. It's safety, safety, safety for sure. And then transitioning to help if we've lost someone to suicide, suicide loss support groups, I would recommend to everybody. Problem is, not a lot of people going, and we got to figure out why. Cedar Valley Hospice has a group here in the Cedar Valley. Waverly has a group. And then kind of the surrounding, Manchester has a group, Des Moines has a bunch of them. So our closest would be hospice, and then Waverly. Huge help to me in life, realizing, oh, there's other people that have lost someone and are hurting. Now we can kind of be a family. That's kind of how our nonprofit started, actually, is we realized we're not alone. Let's try to help other people.
So there isn't, I guess, there's not a magical thing, like for instance in my situation, that I could have said that would have stopped this from happening?
I think, Amanda, if you know somebody's struggling, if you know someone's depressed, if you know somebody's thinking about it, one of the myths out there is that if you talk about it, you're going to give them the idea. They already have the idea. What they need to do, and I've been in the business, like Chris said, a little while. I've seen people's shoulders actually sigh when I see them for the first time and say, have you ever thought about hurting yourself? They want somebody to ask. Then it gets a little more complicated for me as a mental health professional, but a family member needs to stay with them, get them to help. I'll go with you. Let's call your doctor, let's call the mental health center, let's go to the Allen Mental Health Walk-In Clinic, let's go to the emergency room, so it doesn't have to get worse. And sometimes, like Zach said, it's the reluctance to go, but then you hear the stories of people say, I got on medication, I'm seeing a counselor, and now I have hope, whereas I didn't have hope before.
And
So
Amanda,
there's-
what I'm hearing you ask is the question that every loved one and family member who's ever experienced this type of loss is going to ask is, what did I miss? What could I have done differently? Why? There's this second victim there. So again, that going back to Ryan and the suicide support groups, that they're such a wonderful resource, and NAMI and anyone else. I mean, there's so many resources out there in the community. There's always a second victim with this, and it's important to realize that, because someone who may have experienced no real loss, no mental illness at all, becomes a victim of this or survivor, and boy, the cycle can really easily repeat itself.
Well, thank you for pointing out the resources for grieving loved ones, because I do think that's something that people miss sometimes. And I appreciate what you said about how they become a second victim. It's nice to know that there are other people going through this and that we are not alone in dealing with this. And so I appreciate the work that you all do to make things safe here for everybody in the Cedar Valley. So thank you very much.
Thank you for
you.
doing the show.
You bet.
Now, usually we would close it out and I would say something like, see you next time, CF. But right now I just want to say, I hope that everyone is healthy and happy, are managing and knowing that they are not alone. And I wish you just good health, Cedar Falls.